Hey guys, Dr. St. Jean here at ChicagoChiropractor.com. In this video, we're going to talk about how you can tell whether or not your low back pain is simply just low back pain or it's a medical emergency caused by Cauda equina syndrome. Keep watching. So you have low back pain. Maybe it's severe and you're wondering if you should be worried or not. Most of the time, it's nothing to be worried about. But that's why I created this video, so you can tell whether or not your low back pain is a medical emergency. So you have low back pain, maybe it's severe, and you're probably wondering whether or not you should be worried. Take a deep breath. Most of the time, it's nothing more than back pain. However, I like to always aid on the side of caution for your protection and safety, because if your back pain is actually caused by Cauda equina, which is a medical emergency, then you need to get to the emergency room stat. So let's go over 3 simple questions you have to ask yourself right now to determine whether or not your back pain is in fact a medical emergency. The first question you should ask yourself is, do you have numbness and tingling in a saddle-like distribution along with your back pain? What do I mean by saddle-like distribution? Imagine yourself sitting on a saddle, a horse's saddle. Which portions of your body are touching the saddle? So think of back of your thighs, buttock, around your anus and sexual organs. If those areas have numbness and tingling and you have low back pain, go to the ER. Second question, do you have abnormal weakness in your lower extremity? Did your legs all of a sudden go weak along with your low back pain? Now keep in mind, this sign doesn't necessarily mean you have Cauda equina every single time, okay? But better safe than sorry. So if you're having low back pain and all of a sudden you have random weakness in your lower extremity, go to the ER to be safe. The third question you want to ask yourself is, do you have bowel or bladder or sexual dysfunction in conjunction with your low back pain? If any of that is going on, you know what I'm going to say, go to the ER. So there you have it. 3 questions that you can ask yourself right now to determine whether or not your low back pain is a medical emergency. Just to reiterate, do you have numbness and tingling in a saddle-like distribution? Have you had recent onset of lower extremity weakness? And do you have any sexual, bladder, or bowel dysfunction associated with your back pain? Keep in mind that not all of these things have to happen once, and sometimes they happen slowly over time. So if any of these symptoms really are going on with low back pain, you really want to consider it a medical emergency. So what the heck is Cauda equina syndrome? Well, it's a medical emergency, hence the purpose of this entire video. But keep in mind, it's very, very rare, but that doesn't mean that you shouldn't know about it. So I want to describe it a little bit more so you have an idea of what's actually happening inside your body. So there's this bundle of nerve roots that come off the end of your spinal cord in your lumbar spine, in the region of your lower back. And it's called your Cauda equina, which essentially means horse's tail. Now these nerve roots send and receive very important messages from your pelvic organs and your lower extremity. If and when these nerves are compressed, it affects the ability of these nerves to transmit information for you to be able to feel and move the affected areas that are innervated by these nerves. And the bowel and the bladder are especially vulnerable in these situations. So this is essentially what's happening in Cauda equina, compression to the Cauda equina, which causes all of the symptoms that I've shared with you. Again, I'm going to stress this point that you really, really need to seek out immediate care. It's not something worth gambling. If you don't seek out immediate care and you do have Cauda equina syndrome, we're talking about permanent paralysis, loss of sexual function, impaired bowel bladder, not a good situation. Now, Cauda equina is most commonly caused by a massive disc herniation. And again, if you're suffering from back pain with any of these symptoms, don't go to your chiro, don't go to your PT, don't go to your primary care, don't come to me, don't call any of us. If you do call, maybe it's just to verify symptoms, but I'm going to tell you, don't even waste that time. Go straight to your ER. It's not worth chancing. If you enjoyed this video, make sure to give it a thumbs up and subscribe to our channel. If you're ready to take action and identify and eliminate the root cause of your low back pain, schedule your free consult by clicking the link below in the description underneath this video. This is Dr. St. Jean from the Chicago Chiropractor. I'll see you next time. Bye-bye.